Imagine a child sitting in a classroom, staring at their test paper, heart pounding, hands shaking. Their mind goes blank, even though they studied for hours. Or a child who refuses to go to school, not because they dislike learning, but because they fear being judged, making a mistake, or simply being away from their parents. These are not just cases of nervousness, these are signs of anxiety disorders, one of the most common yet often misunderstood mental health conditions in children. Anxiety in itself is not a bad thing. It's a natural response to stress, a built-in alarm system that has helped humans survive for thousands of years. But what happens when this alarm will not shut off? When everyday situations, going to school, talking to new people, or even falling asleep alone trigger overwhelming fear? That's when anxiety shifts from a normal emotion to a disorder that interferes with daily life. Research shows that about 7.1% of children aged 3 to 17 in the US have been diagnosed with an anxiety disorder. However, studies suggest the real number is likely much higher, as many children remain undiagnosed due to symptoms being mistaken for shyness, stubbornness, or even misbehavior. Childhood anxiety is not just about being scared or worrying too much, it manifests in different ways, and the types of anxiety disorders in children vary widely. One of the most common forms is generalized anxiety disorder, where children experience chronic, excessive worry about a wide range of everyday things, school performance, friendships, family issues, or even hypothetical disasters. They may constantly seek reassurance, struggle with sleep, or complain of stomach aches and headaches with no medical cause. Some children with GID are labeled as perfectionists because they are terrified of making mistakes, but beneath this perfectionism lies an overwhelming fear of failure. Then there's separation anxiety disorder, which is particularly common in younger children. While most kids feel some distress when separated from their parents, children with separation anxiety experience intense fear, crying, clinging, refusing to go to school, or even experiencing nightmares about something bad happening to their parents. This goes beyond normal attachment and becomes debilitating. Studies show that separation anxiety affects up to 4% of children and can persist into adulthood if untreated, sometimes leading to panic disorder later in life. Social situations can also become a battlefield for some children. Social anxiety disorder goes far beyond shyness. It's a deep fear of being judged, embarrassed, or humiliated. A child with social anxiety might freeze when asked to speak in class, avoid eye contact, or refuse to participate in activities they secretly enjoy. Research indicates that social anxiety often starts in childhood and, if untreated, can become a major obstacle in adulthood, affecting relationships, career opportunities, and overall well-being. Phobias are another common form of childhood anxiety. While it's normal for children to have fears of the dark, monsters, or loud noises, phobias are intense, irrational fears that do not fade over time. A child with a phobia of dogs, for example, might refuse to go to a park where they could encounter one, even if the dog is on a leash. These fears can disrupt daily life and limit a child's experiences, yet they are often dismissed as something they will grow out of. Perhaps one of the most severe forms of childhood anxiety is panic disorder, though it is less common in young children. A panic attack is a sudden, intense wave of fear accompanied by physical symptoms: racing heart, dizziness, shortness of breath, and an overwhelming sense of doom. Imagine a child experiencing this, not knowing what is happening, and fearing they are dying. Without proper understanding, these attacks can become traumatic in themselves, leading children to avoid situations where they have panicked before. What causes these anxiety disorders? The answer is a mix of biology, environment, and experiences. Research on genetics suggests that children with an anxious parent are up to 5 times more likely to develop an anxiety disorder themselves. This does not mean anxiety is purely genetic, but that certain children are born with a more sensitive stress response system. Environment plays a major role as well. Children who experience high levels of stress, trauma, or unpredictable environments such as divorce, illness in the family, or even excessive academic pressure are at a higher risk of developing anxiety disorders. One landmark study, the Adverse Childhood Experiences Study, found a direct correlation between early life stress and mental health issues, showing that children who experience multiple stressful events have a significantly higher likelihood of developing anxiety and depression later in life. Neurological research has also shed light on how anxiety functions in the brain. The amygdala, the part of the brain responsible for detecting threats, is overactive in children with anxiety disorders. This means that even harmless situations like answering a question in class can be perceived as a threat, triggering the body's fight or flight response. Over time, this response becomes automatic, making children feel anxious even when no real danger exists. One of the most famous case studies in anxiety research comes from the 1920s Little Albert experiment by psychologist John B. Watson. In this controversial study, a 9-month-old baby was conditioned to fear a white rat by associating it with a loud, frightening noise. Over time, Albert developed anxiety responses to anything white and fluffy, including rabbits, dogs, and even a Santa Claus beard. This experiment was one of the first to demonstrate how fears could be learned, suggesting that some childhood anxieties stem from experiences rather than genetics alone. Understanding anxiety in children is crucial because untreated anxiety can lead to lifelong challenges. Studies have found that children with untreated anxiety are more likely to develop depression, substance abuse issues, and even physical health problems later in life. But the good news is that anxiety is highly treatable, especially when identified early. The way we talk to children about anxiety also makes a difference. Instead of saying, "There's nothing to be afraid of," research suggests it's more helpful to say, "I know this feels scary, but you are safe and you can handle it." Teaching children coping strategies such as deep breathing, mindfulness, and gradual exposure to fears has been shown to significantly reduce anxiety symptoms. Cognitive behavioral therapy, one of the most effective treatments, helps children reframe anxious thoughts and develop confidence in facing fears. As the famous psychologist Dr. Aaron Beck once said, "The way we think about events determines how we feel about them." Helping children reframe their fears, understand their anxiety, and develop coping skills can change the trajectory of their lives. Anxiety might feel overwhelming, but with the right support, children can learn not just to manage it, but to thrive despite it.